This is your host Khushi Awasthi, and you are watching our featured show Rubaroo. Before we begin with our today's conversation, let me first introduce you all with our today's special guest. So, joining us today, we have Dr. Yusuf, Dr. Yusuf.
Hello.
He is a robotic heart surgeon who has developed the robotic heart surgeries and therapies in India. He has done the highest number of heart cardiac surgeries, and he is the proctor for robotic cardiac heart surgeries in Asia Pacific. And we also have Dr. Kartik Ramesh. He's a visionary leader and chief transformation and innovation of UWIN, which is owned by the royal family of UAE. Sir, we are so, let's say, it's a pleasure to have you all in this show. And we are so excited to dive in with the conversation. But before we begin, I would like to ask you both, how does it feel to be here today with us?
It is a real pleasure to be here, and it's also an honor to be in this prestigious um, organization, which we are able to speak out what we want to deliver to the public.
I think I want to thank Dr. Sandeep Marwah ji and Marwah Studios on behalf of also Dr. Yusuf to be here amidst a visionary, a leader par excellence, who is an inspiration, I would say, to millions, not just in India, but across the world. So it's always an honor and privilege to come because this platform has been the right medium for us to transmit a lot of information and knowledge about cardiac disease, cardiac treatment, because India today is a world leader in cardiac disease. So thank you again, Khushi. We look forward to the conversation.
I guess you both are so expert and have high vision in this field of medical and healthcare. So my question is, how do you deal, or let's say, educate the people in a country like India, where people are not aware of what healthcare is and what are the healthcare requirements or what are the hygiene needs? How do you deal with it?
Yes. So let me start off where Kartik just introduced. So it is heart disease. Heart disease, more than 50% of heart disease in the world is present in India.
Okay.
So that's something which is preventable. So main thing is about educating people on primary prevention. So there are 5 factors, as we say, are risk factors for the usual heart attacks, the ischemic heart disease, which is diabetes, which cannot be controlled by us, but definitely can be kept under control. Smoking, which is entirely in our hands. Blood pressure, cholesterol, these are also within our hands because we can control our lifestyle and food habits.
Yes.
So this way we can prevent these 4 problems from causing the effect, which is the heart disease. Of course, the other problem is family history, which is not entirely in our hands. But for patients who have a family history of heart disease, we suggest having regular health checks. Of course, anybody over the age of 40, we would suggest having a health check at least once in 2 years. And when they get to 50 or more, every year. This is a primary prevention measure that anybody can follow. We don't need to run through a big range of tests, but the basic health check and taking precautions to prevent problems. So, preventive healthcare is what I would like to convey to the public today.
I think it is, thank you, Dr. Yusuf, has beautifully summarized it. There's nothing more to add. It's an honor to be on the dais with such a legendary, as you said, Kushi, robotic cardiac surgeon. I think the education, as doctor said, is today now also in the age of AI, artificial intelligence, moving to robotic cardiac surgery, which we will discuss today. So I think the awareness about how robotic cardiac surgery can help patients is a great topic for us to discuss today. Thank you.
As you mentioned about AI, we all know that AI is in its baby stage. It's not mature yet. How do you see AI can be affecting or can be impactful in achieving the goals that you are looking for?
AI in healthcare is going to make a huge difference, which already is in certain specialities like radiology. But this integrating AI into surgery, which is my field of interest, will be very helpful. It is, as you said, it's in the very infant stage because robotic cardiac surgery, technology based, now data from surgeons are being pulled in. So this hopefully in future will integrate with AI and that will make some steps of the surgery. It's not that we don't expect the robot to completely perform the operation because each individual is very different to the other. But it will make certain steps, basic steps, easier by integrating. That's what we vision it as. And also telesurgeries by operating, sitting in one place, operating anywhere in the world is becoming a possibility. I think all these things AI would help. But I think Kartik, as an AI expert in the world, is one among the 200 in the world. So he may be able to tell more about this field.
Thank you, doctor, for giving those insights of AI integration with healthcare. I will sum it up, in 3 points. If I split the word AI into A and I, Harvard Business Review says AI is no longer artificial intelligence. It has to be authentic.
Yes.
When does authenticity come? When there is a human behind the intelligence. In this case, when there is an expert robotic cardiac surgeon like Dr. Yusuf, who is backing the use of technology and AI to help cure a patient's cardiac disease, it becomes authentic. The second point, AI is also augmented. It is not just artificial, it is an augmented intelligence. Let us take robotic cardiac surgery, which doctor will explain shortly. It is of no use if it is not augmented by the intelligence and the expertise of a cardiac surgeon. And that is somebody again like Dr. Yusuf. Number three, AI today has become accessible intelligence. We live in an era where I can take my mobile phone, I can ask ChatGPT whatever, I can ask Google Gemini, I can talk to Microsoft Bing. We are living in an age where Chinese DeepSeek startup has come up. So more and more AI is becoming accessible. So the relevance of data, domain, the relevance of security. When you talk about healthcare, the personal information, the privacy, confidentiality of information. So it is a combination of these factors. But without people like this gentleman who is seated here amongst us, AI is absolutely of no use. The last AI is absolutely no use intelligence if there is no expert like a Dr. Yusuf behind it.
I guess it is the high time when I have to hand over my seat to you, because I'm not really an expert to ask such questions from him. He's way more better than me.
No, I think you
And
asked some great questions, Kushi. Thank you for setting the tone. Thank you again, Dr. Yusuf, for being with us today. And it's a privilege for me to share the dais and enlighten ourselves on this very interesting topic, Doctor, of robotic cardiac surgery. Usually, when we say cardiac surgery itself, people get very scared. Now, when we hear robotic, does it mean that robot is doing the work or a surgeon? Can you please explain a little bit, sir?
Yes.
How does it work? Yeah.
Thank you, Kartik. It's really nice to sit with you as well. And the major, as you mentioned, the major problem or fear of heart surgery is cutting open the central chest bone, which is a major fracture that we create. To the patient, there are two impacts. One, the trauma cost is equivalent to a major road traffic accident. So the body as a whole has to recover from that. That takes about 3 to 4 months or 6 months, depending on age. And the other major impact is the fear. So the patient, they feel my whole chest is cut open. How will I recover from that? So these are the two major, so mental impact and the physical impact. Both are very high with heart surgery. So the patients a lot of the time put it off until they become really sick. Now with robotic heart surgery, we are able to avoid that cut completely. So there's no bone cut at all. We make tiny holes less than 1 centimeter, one or both sides of the chest, and there will be a 3 to 5 centimeter skin cut. Even the muscles below are split. There's no other bone cuts or anything. And we use the robotic camera and arms. So the robot does not do the operation on itself by itself, but they have four arms with nice dexterity. It moves around everywhere. So we use those forearms through the holes as required and do the operation. The advantage of this operation is the precise nature. So the vision is 20 times magnified, HD vision, with nice dexterity. But the disadvantage is we don't have the tactile sensation. The feel is lost. So that's the reason it takes longer to learn this procedure.
Sure. And Doctor, we are aware that you are part of the reputed Apollo group of hospitals in Chennai and also here Delhi, where we sit, Indraprastha. So you are conducting these procedures in both these centers. Can you tell a little bit about that?
Yes. So we started the program, as already mentioned, I started the program in India, or restarted, I would say, because in 2000 it was started and then it died down due to various reasons. The equipments were not available, surgeons were not trained. So I trained abroad for many years, then came back to my native town, with Chennai. So we started the program there just over 5 years ago, and seeing the benefits of the program. But now robotic surgery is well established in most specialties. I would say cardiac surgery is the last to take. So outside India for the last 2 decades it's been practiced, where I trained as well. So we started the program there in Chennai, and seeing the benefits, which is, as I said, because we just make tiny holes, the patient benefits is they have very little blood loss. Because the trauma is avoided, there's no infection. They recover extremely quickly. Usually, patients are discharged third or fourth day.
Right.
If it's only single block, we discharge them the next day.
Sure.
And within 2 to 3 weeks, they completely recover. So this outcomes, and we have had excellent outcomes compared to across the globe. These outcomes made us think to spread. Our chairman, Dr. Pratap Reddy, made sure I wanted this therapy to be spread across the country. Then we chose Delhi next, which we have been operating here for the last 2 years. I come here every other week and we operate with our team, which is established here. So this is how we are able to provide this therapy across these two centers. Our vision is to spread it all across India, and as you already mentioned, I am a proctor for this therapy. So we have trained surgeons not only in Apollo or corporate hospitals, but in the government sectors as well over the last few years. Currently, there are about 12 centers performing this procedure
Sure.
across the country. We expect it to grow much more quickly now.
Thank you, Dr. M.M. Yusuf, for elucidating this complex topic in such a simple manner, talking about the advantages, the speed of recovery. And it's an eye opener that, Apollo Hospitals is leading this mission of not only doing it themselves and showing the way, but also enabling other hospitals and doctors, as you said, your training. And so, on the personal side, I want to ask, how do you manage the balance? These surgeries, I know normal cardiac surgeries are long. As you rightly said, robotic needs more dexterity, more focus. So, how are you managing your time? I mean, a lot of young people, young aspiring surgeons, what would your advice be to them to become like you, so well versed in technology and managing the time as well?
Yes. So I think that's a part of my training in the West has helped me
Okay.
in organizing myself.
Right.
And as a family, my wife and children help me as well a lot, because they have to put up with my longer hours. So that's contributed, allowing me to spend more time during my learning years. And now this is what I do to my junior colleagues. So we train surgeons, like in Delhi, we trained the surgeon, Dr. Bansal, who is here now, in Chennai, and then brought him here. So who is now able to manage with my supervision. So we have strict protocols, systems in place, and we spread the same infrastructure and personnel across different centers that we operate. So since I've been proctoring and going to different places, I pick up things as we go, learn good things and things that we should avoid when we move around and spread the therapy. So that's the way we have been managing, operating in different centers, forming a system, protocols, and organizing ourselves and our times, and keeping everything safe for the patient.
So wonderfully explained again, Dr. Yusuf. I think it was nice that you acknowledged, your family, Mrs. Punita and Yusuf, your two lovely daughters, and the way you have institutionalized the process, a system, and a methodology which is foolproof, sharing the best practices and the infrastructure. So thank you for sharing that. What is the future for your organization, where I know also Mrs. Punita and Yusuf is involved in terms of Yusuf Idayam? What is the future that you both envision to carry forward newer and better technologies and this legacy to the next level? Could you share some views on that?
Yes, sure. Thank you for asking that, because that is our work for the future. So as I said, this we want this therapy to spread across the country. And the other big one of the big reasons for us coming back to India after 20 years of training abroad is to give back to the country.
Right.
We want to make this affordable and accessible to almost every citizen of our country. So we are working with our MMY Idayam company and with help of you and other people uh, like Sadhguru. So we are now in the process of making devices and instruments to, as I said, this has a longer learning curve.
Right.
So we are trying to make this accessible and affordable for more surgeons to adopt easily.
Sure.
So by bringing up these devices and instruments, more surgeons can easily adopt and make it more foolproof for patient safety.
Sure.
This is what we are working towards, providing a better healthcare for the country, at least in my specialty, which I'm
Wonderful.
working at.
So, sir has given us a beautiful preview, Dr. M.M. Yusuf, of a new technology which he is bringing in, which we don't want to disclose because it is patent protected and certain copyrights are there. But we look forward to a very exciting times where in the minimally invasive robotic cardiac surgery, you will further simplify the process. You will further make it affordable, which is the need of the hour. And I think for all viewers who are looking at talking about making in India, doing things for India, coming back to India after 20 years in the UK, tell us a little about that. How did you manage to shift both professionally and personally? I mean, coming from an advanced setup in the medical fraternity of UK to India and to restart it here to come to this level. And how did you manage personally the transition?
Yes. So I think here I should say more than me, my family managed it well.
Sure.
Because it was the support of my wife uh, managing me and my children at the same time. So for us, it's a big shift in the healthcare system, but the infrastructure is no different to the West in the big corporates, at least Apollo, where I'm working. We have similar infrastructure, but the way we work around personnel has had to make some changes.
Sure.
So it was a bit difficult for the first couple of years, but now I think looking back, we came at the right time, bringing in a new technology, and this is the best way to grow. So robotic cardiac surgery, India is growing much faster than the US.
Sure.
So we have had the CEO of the major company come over and meet us to see how we can take it further. So that's the rapidness of the growth of this specialty in India. So that's how we have accommodated and started growing.
Wonderful, again, that you keep acknowledging the support of your family. They say behind every successful man there is a woman. In your case, I will add your two daughters and I'll say behind the successful Dr. M.M. Yusuf, there are three women, your wife and your two lovely daughters. And my other question here is, you mentioned about the Da Vinci company and their CEO visiting India. Why has it taken time for the cardiac surgery in robotics to move up the curve to this level versus we see knee surgery and orthopedics and so many other where they use striker robots and other things. It has caught on earlier. And why is it that there has been a slight lag, if I can say, if I'm right in this journey?
That's a very good question. It goes a long way back. In fact, the robot was invented and first given to cardiac surgery.
Okay.
But that time, as I already mentioned, the current robot is a fifth generation now. The first generation was very different, and surgeons were learning minimal invasive surgery then. This was in the early 1990s.
Sure.
So now we are well versed with minimal invasive surgery, and we could apply both together.
Sure.
That is the reason I was able to restart the program. So initially it started and died down due to poor outcomes
Sure.
and inability to perform and provide the same outcomes as open surgery.
Sure.
But then it now with all specialties, some specialties well established, and with slowly surgeons picking up skills and integrating them together, now the company has seen the advantage and the next specialty that could have huge amount of growth. And the biggest, one of the biggest advantages, if anybody can have, is in cardiac surgery where the split in the chest is completely avoided. The biggest morbidity is taken off. So this would be one specialty which would benefit the most compared to many other specialties.
Thank you, Dr. M.M. Yusuf. I'd like to conclude by having a quick rapid fire with you. One word of inspiration to aspiring robotic cardiac surgeons? If you had to tell one word to them to be successful, what would that one word be?
Robotic cardiac surgery is the future, not only cardiac, every specialty. So embrace technology, use it appropriately, think about patient safety.
Wonderful. Embrace technology, use it appropriately, and think about patients. I think you brought in beautiful aspect of ethical AI. Outside robotic cardiac surgery, what is the one thing you like to do? If you had time between surgeries, what would you like to do?
I would like to spend more time with my family.
Wonderful. You mentioned your family a number of times. So could you tell us what your daughters are doing today? What are they doing?
Yeah. So I have to tell about my wife first.
Sure.
She is a law graduate, gave up practicing because of the family and
Wonderful.
my job. So she runs a lot of charitable organizations and small business firms because she's a business graduate as well. So in
Wonderful.
support, and these businesses support many small families.
Sure.
So that's her side of things. And my elder daughter, she works at the United Nations organization.
Wow, UN. Okay.
Yes, and she's based in the US now. And my younger daughter is venturing into corporate law. She's based in London. So
Amazing.
they are,
So I think for this family, we can say like parents, like children. So that
we
is
are
really
blessed.
amazing. You're really. The last question which I want to ask you, Dr. Yusuf, is recently you have met Sadhguru Sri Madhusudan Sai, who is carrying on a global mission, humanitarian mission of spreading free cardiac care through 18 plus hospitals, 12 in India and outside. What is the scope of collaboration with such humanitarian organizations embracing technology, and how do you see the future working together with such organizations?
Yes. It was a pleasure and honor meeting him, and thanks you for introducing us to Sadhguru. It was a great evening, and the vision, what he has, is exactly what we have as well. So we want to give back to as many people as possible in an affordable manner. With basically, everybody in our country, they should have the healthcare which is parallel and available. It shouldn't be based on what they can afford. I think that is Sadhguru's vision, which we really want to be collaborated with in the future.
Thank you, Dr. Yusuf, and thank you, our viewers. It was an honor and privilege to have a legendary robotic cardiac surgeon, the topmost number of surgeries done in India and in Asia Pacific. One of the two proctors, leading proctors of this robotic cardiac surgery, who's continuing to push the envelope of technology, embracing, you know, the best of institutes of eminence, partnerships with humanitarian organizations. Such an honor and privilege again to have you here, sir. We hope to have you back, and thank you once again. Sincere, heartfelt gratitude to my inspiration here, Dr. Sandeep Marwah, who has been such an amazing host to us always and who has created this wonderful platform of Rubaroo on Marwah Studios, which gives connections and opens us to the possibilities by meeting such legends. Thank you once again, sir.
Thank you. Thank you to Mr. Sandeep Marwar and Marwar Studios. Thank you.
Well, sir, I must say it was truly worth spending my time with you. I'm so honored to have you people on this show, and we are really thankful. For more eye opening conversations like these, don't forget to follow our show. We'll be back here. Thank you.
Thank you, Gushi. It was a
Thank you,
great
sir.
time with you.